everyone, my name is Daniela and I'm a volunteer with For a Safer Space. Today's presentation is on specific phobias. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use the land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Today's agenda will include a brief introduction, followed by what are specific phobias? Specific phobias versus complex phobias, statistics, causes of specific phobias, risk factors, warning signs, complications associated with specific phobias, treatment, misconceptions about specific phobias, coping with specific phobias, supporting someone with specific phobias, supporting a client, and to conclude, resources and key takeaways will be discussed. Specific phobias are classified by overwhelming and unreasonable fears of objects or situations that are not threatening, but result in anxiety and avoidance. Specific phobias are different than general fears as they can involve an increased fear response, are more long-lived, and can impact individuals to a higher degree. However, there are steps that can be taken to minimize the impacts of the phobia and the phobia itself. What are specific phobias? Specific phobias are classified by overwhelming and unreasonable fears of objects or situations that are not threatening, but result in anxiety and avoidance. In contrast to the short-lived anxiety that one may experience when public speaking or taking a test, specific phobias are long-lived, cause strong physical and psychological reactions, and can impact someone's ability to function normally in various settings. Specific phobias are one of the most common anxiety disorders. However, not all phobias will impact individuals to such an extent where it affects daily life. Specific phobias versus complex phobias. Phobias can be about any object or situation, and some individuals may have more than one. However, there are two classifications or types of phobias that exist, which are specific and complex phobias. Specific phobias, as discussed, are phobias that surround a specific object or situation, such as animal phobias, phobias about the natural environment, as well as phobias about small spaces, flying, or certain foods. On the other hand, complex phobias can often have a more disruptive and overwhelming effect on one's life, and often develop during adulthood. Common phobias for this type include social phobia and agoraphobia. Now we will look over specific phobia statistics to see how many people this impacts. For individuals in the United States over the age of 18, approximately 9.1% experienced a specific phobia within the last year. As well, it is evident that there is a divide between those impacted, with 12.2% of females and 5.8% of males experiencing specific phobias. About 12.5% of adults are said to experience specific phobias during their lifetime. And finally, out of the population impacted by specific phobias, about 21.9% experienced serious impairment, 30% experienced moderate impairment, and 48.1% experienced mild impairment. Causes of specific phobias. The direct causes of specific phobias are under-researched and unknown. However, it is said that causes can include the following. Negative experiences. It is common for phobias to develop after having a negative experience or panic attack in relation to a specific object or situation. Genetics and environment. There have been links seen of one specific phobia and the phobia or anxiety of parents, either because of genetics or learned behavior. And brain function. Alterations in brain functioning can impact the development of specific phobias. Risk factors. There are particular risk factors that can heighten the probability of developing specific phobias, which can include age. Some specific phobias can first develop during childhood, typically by the age of 10. However, they can begin at any point in one's life. Relatives. If a relative has anxiety or a specific phobia, it can increase one's risk of developing one. Temperament. This can heighten the risk in those who are more sensitive, inhibited, or negative than the norm. Negative experiences. Traumatic or frightening events can trigger the development of particular phobias, such as being trapped in an enclosed space or being attacked by an animal. And finally, learning about negative experiences. Listening to or learning negative information as well as experiences can increase the chances of developing a specific phobia, such as hearing about a plane crash. Warning signs. There can be various types of phobias that individuals can develop. However, the warning signs will typically be the same and include the immediate feeling of strong and intense fear, anxiety, and panic through exposure to or thinking about the object or situation. An awareness that fears may be unreasonable or seem exaggerated, but they may still be unable to be controlled. Increasingly worse anxiety as the object or situation gets close to the individual, either through time or physical distance. There's a strong avoidance of the object or situation, or enduring it with strong anxiety or fear. Individuals can have challenges functioning normally due to this fear. There may be physical reactions such as sweating, heart palpitations, tight chests, or challenges breathing. Individuals may feel nauseated, dizzy, or faint around blood or injuries. And in children, there is the possibility of tantrums, clinging, crying, or refusing to leave a trusted adult's side or approach the object or situation. Complications associated with specific phobias. While specific phobias can seem odd to those around the individual, they can impact the individual greatly in various areas of life, including social isolation. Due to the increased risk of avoidance, it can result in challenges academically, professionally, and in relationships. Mood disorders. Many individuals with specific phobias also experience depression or other anxiety disorders. Substance use. Due to the stress of living with specific phobias, it can lead to the development of substance use disorder. And finally, suicide. Some individuals with severe specific phobias can be at risk of suicide. Treatment. Now we will look over some treatment options for specific phobias, which can include psychotherapy and medication. The goal of using any of these management methods is to minimize the phobia so that it does not impact daily life as much. Psychotherapy is a commonly used method which can include discussing with a professional how the phobia can be managed, often used as exposure therapy and cognitive behavioral therapy. Exposure therapy includes gradual and repeated exposure to the source of the phobia and the related thoughts, feelings, and sensations that can help manage anxiety. Cognitive behavioral therapy, or CBT, can include exposure and other techniques to enhance views and cope with the phobia differently. Medications are another option which can be used. This includes beta blockers, which block the impacts of adrenaline that are the result of anxiety, or sedatives, which minimize the amount of anxiety felt. It is important to note, though, that sedatives can be addictive. Misconceptions about specific phobias. There are various misconceptions surrounding specific phobias, and we will take a couple of minutes to deconstruct them. This is an important step in better understanding the impact phobias can have on some individuals and deconstructing the stigma around its impacts, as these misconceptions spread misinformation and can stereotype individuals. The first misconception is phobias are not serious. This is untrue. Phobias can cause severe anxiety and distress for individuals, leading to difficulties with normal functioning. This misconception tends to derive from the belief that fears and anxieties are a normal part of life. Thus, phobias are too. However, the anxiety faced by those living with phobias can be debilitating. As well, it can lead to avoidance, which can further impact their quality of life. Another misconception is phobias are merely overrated fears. Phobias are more than fears. They are connected to a strong biological and psychological fear response. While there are comparable reactions from the brain and body in both fears and phobias, the activation in the fear responses is heightened in phobias. And finally, phobias cannot be overcome. Phobias can be overcome. There is strong evidence that shows exposure therapy done in a safe environment can benefit those living with phobias. This misconception can harm as it leads to the belief that phobias might not be worth reaching out about, leading to individuals keeping it to themselves. However, with support, individuals often minimize the impacts that a phobia has on their life. Coping with specific phobias. There are steps that can be taken to cope with a phobia. While this list is short, there are other methods that may also benefit individuals due to personal interests or de-stressing strategies. However, with that said, these are some great steps to take to cope with phobias. The first being, aim to not avoid feared situations. Actively practicing exposure on your own can be healthier than avoiding the object or situation, as it will become easier with practice. Others around you can assist in practicing this. Reach out. Reaching out to others, a professional, or joining a support group can all be ways to reach out to others who will understand or listen about your lived experiences. Practice self-care. Ensuring you get enough rest, eat well, and take care of yourself physically can minimize anxiety. And finally, celebrate. It can be key to celebrate all successes, and celebrate even when a goal is not met, but the effort was made, because that is an accomplishment within itself. Supporting someone living with specific phobias. There are many ways to support someone living with a specific phobia, which can include educate yourself. This can include learning about phobias as a whole and about the experiences that the individual has with their phobia. Avoid adding pressure. While avoiding a situation can worsen the phobia, it can also cause the stress to be coerced or forced into situations prematurely. It is important to not force the individual to do something they are not ready or comfortable with. Support them in finding help. Sometimes individuals may not know where to go to find professional support. Therefore, it could be helpful to assist them in looking or going to an appointment with them. Most important is to center self-care and your own mental well-being by setting boundaries, reaching out to others, and taking time to do enjoyable activities to de-stress. Supporting a client. There are various ways that practitioners can support clients living with phobias, with the key method being exposure therapy, and there are various types of exposure therapy which can include in vivo exposure, which encompasses confronting the feared object or situation gradually. For instance, in the case of spider phobias, it may have someone looking at a picture of a spider to begin, and then slowly work up to being around a spider. It can occur over one long session or multiple smaller sessions. Another type is virtual reality exposure. This utilizes a computer program to create the phobic situation and allows the individual to react. This is typically used for phobias that cannot be done through in vivo exposure, such as height or flying phobias. The final type is systematic desensitization. This exposes individuals to anxiety-inducing thoughts and images or the actual situation or object, while using relaxation techniques to limit the fear response. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. To conclude this video, we will go over some key takeaways. Specific phobias are classified by overwhelming and unreasonable fears of objects or situations that are not threatening but result in anxiety and avoidance. While specific phobias center on an object or situation, complex phobias can be more disruptive and typically include social phobias or agoraphobia. While the direct cause of phobias are unknown, there are some links to experiences and biology that can explain the occurrence. As well, there are various risk factors and warning signs for specific phobias. Specific phobias can cause complications in other areas of life, such as with the development of other mental health disabilities. Treatment options for specific phobias can include psychotherapy and medication. Furthermore, it is important to deconstruct misconceptions about specific phobias as they perpetuate misinformation, stereotypes, and stigma. Individuals can take steps to cope with specific phobias. Similarly, individuals can take steps to support those living with specific phobias. However, it is important that they center their own mental well-being. Finally, practitioners can use exposure techniques to assist clients in minimizing their phobia. That concludes this presentation on specific phobias. Thank you for watching.